Welcome to the HTLL podcast. We are your co-hosts, Tino Movuti, Technical Advisor for WASH,
and Emily Hirata, Technical Advisor for Health and Nutrition.
In today's episode, we're diving into a critical global health issue, non-communicable diseases, or NCDs, which are responsible for the majority of deaths worldwide. We'll explore how holistic health practices, particularly through the Celebrations program, can play a vital role in preventing and managing these diseases. Joining us today are two distinguished guests who bring a wealth of experience and insight into this topic. We're honored to welcome back Dr. Peter Landless, Emeritus Director for Health Ministries at the Seventh-day Adventist Church World Headquarters, who will share his expertise on the Celebrations initiative and its impact on global health. We're also joined by Dr. Josue Orellana, Director for Health, Nutrition, and WASH at ADRA International, who will discuss the innovative Celebrations program being rolled out in Mongolia. Together, we'll discuss the importance of partnerships between organizations like ADRA and Adventist Health Ministries. Welcome to the podcast, Dr. Orellana.
Thank you very much. It is a pleasure for me to be here. It's a privilege for us, for ADRA, also to have Dr. Landless with us today.
And likewise, welcome to the podcast, Dr. Landless.
Thank you very much. It's my privilege and honor to be with you. And I deeply appreciate and value the tremendous work that you as a team are doing. Thank you for the honor.
Yes, thank you so much to the both of you for being here. Dr. Landless, I would like to start with you. Could you start by giving us an overview of the Celebrations program and its core principles, and how did this initiative come about? What are its main goals, etc.?
Thank you so much, Emily. It's a pleasure to talk about celebrations. It's a term which is an acronym term. It talks about choices. We each have to make a choice. It talks about exercise, the importance of liquids and particularly water. And it also talks about the importance of having some care for our environment, because the environment in which we live is so important. And with climate change, we see how important this really is. We also look at the importance of exercise. We need to move. We need to be active. We talk about also the importance of having belief, something which you can anchor and be grounded with, a faith, a trust in a higher power. And then, of course, there's the important component of rest, R for rest, something which many of us don't do very well. We are so attached to our devices and we are constantly on screen time. Fresh air, A for air. We need to get out and breathe. All those terpenes in the woods that stimulate our health. And then there are also the important principles related to a word which is not often used these days. It's called temperance. Temperance means balance, using all the good things wisely and avoiding all the harmful things. Integrity, being honest, being able to put your head on the pillow at night and sleep with a clear conscience. Science has shown us how important that is. Optimism and hope. People who have gratitude in their hearts, people who journal gratitude, people who live with purpose and hope have longer lifespans, better quality of life. And this is documented in the literature, scientific literature. Nutrition, a core principle and foundational to health and well-being. And when we see in the non-communicable diseases, we see how key this is to people's health. And then a situation and a factor which has grown in our understanding, especially highlighted by the pandemic, and that is of social support. So celebrations takes us through from the choice right through to the social support. We've seen and we've witnessed during this pandemic that's just passed, and we're in the aftermath of it, how isolation has affected people. It has accelerated the use of addictive substances, alcohol, tobacco, marijuana, and other drugs. It has increased the tsunami we are facing of mental health disorders. And so social support, the isolation which we experience and so many experience, even our loved ones dying alone because we couldn't get to be with them, social support is crucial. So it originated, the Celebrations program, and actually was an expansion of 8 basic principles: nutrition, exercise, water, sunlight, temperance, fresh air, rest, trust in God. Those are the basic principles on which this was founded. And it was expanded from those 8 to the 12 in Celebrations. It was expanded by the General Conference Adventist Health Ministries group starting in 2001 to bring a series of life-changing, lifestyle-changing principles which have been shown to bring about improvement in quality of life, longevity, and well-being. These principles originated and were shared with the Adventist Church by one of our co-founders, Ellen White. And that inspiration has stood the church well in its existence, but importantly, and most importantly, I would add, in sharing a holistic message of well-being to the communities we serve. Is there evidence that this works? Well, there are robust studies which have shown that comparing and looking at just the audience and the participants who we were able to study right in the very first Adventist Health study, it was shown that people who followed these principles, avoided tobacco, alcohol, regular exercise being part of the program, careful nutrition, predominantly ovo-lacto-vegetarian nutrition, and all the other components that I've mentioned, it was shown that those people lived 7 to 9 years longer than their non-Seventh-day Adventist colleagues. This was very interesting. It also caught the attention of the National Institute of Health in the United States, and they funded a research up to $19 million to study further in Adventist Health Study 2 why it would be that there's a decrease in cancers, a decrease in heart disease, decrease in stroke, decrease in diabetes, and of course a decrease in chronic lung disease, among other things. And again, these principles have been proven to be helpful, to be life-changing, and to bring about improved health and well-being. So that's the origin, where it really comes from. And for the last 20 years, it has been shared globally. The church has a footprint of 215 countries, and in many of those, we have active health work, sharing in our communities, sharing with through the health institutions we have, but also very importantly, right through each community in which there is a presence of people who believe and follow these principles in their lives.
Thank you so much, Dr. Landless, for that description of the Celebrations program, its core principles. It sounds like it's a really great and comprehensive program that touches on so many different aspects of one's life and core being. Since we're talking about non-communicable diseases and NCDs today, can you tell us, how does the Celebrations program address the prevention and management of NCDs? Could you elaborate a little bit on the connection between the lifestyle factors promoted by Celebrations and the reduction of NCD risk?
Absolutely. And it's very exciting for me to tackle this question, because if we had about 3 or 4 hours, we could fill them all with a conversation regarding this. But in a nutshell, probably a coconut shell, not a peanut shell. We look at the non-communicable diseases, which are defined really as heart disease, stroke, cancer, diabetes, chronic lung disease, and additionally the use of alcohol. We find that in all the principles that have been enunciated in celebrations, there are key components which address non-communicable diseases. It's interesting that it's only on 2 occasions that high-level convocations of the United Nations were called. The first one was for HIV and AIDS, the threat and the epidemic of AIDS. And the second was in 2017-18, when a convocation was called together at the United Nations in New York to discuss the threat of the non-communicable diseases. And these have all been highlighted and aggravated by basic health and lifestyle issues. For example, you look at heart disease related to cigarette smoking, strokes, again, the same thing. The vascular disease, which comes from lifestyle issues, including poor diet, large portion size, lack of exercise, as I mentioned, tobacco smoke. And recently, and interestingly, the scientific literature and the World Health bodies, the various bodies who work with the health of the world, not just the WHO, have brought out and are clearly enunciating that there is no safe level of alcohol consumption. So when you look at all of these components and you look at the research shows us that people who follow these principles as enunciated in celebrations have much less diabetes, have much less hypertension, don't have the same amount of cancer by any manner of means. They don't have similar levels of heart disease, coronary artery disease, and most certainly not strokes. And chronic lung diseases are significantly decreased as well. So you're looking at these principles underscoring and undergirding any effort to try and decrease the non-communicable diseases. Of course, it begs the question and also informs the approach that these principles need to be applied globally. They need to be communicated. They need to be shared not only with people who are literate and illiterate, but health literacy is so important. It's one thing and terribly important for people to be able to read and to write. It's important for communities to have health literacy so they understand why it is that these huge portions, the highly refined foods, highly calorie-dense foods, the sugary drinks, alcohol, tobacco, why it is that that's harmful, despite the tremendous pressure from the industrial and economic communities who wish to make a profit out of all of these unhealthy foods and habits in which people engage. So if these principles are shared widely, if they're understood, and if also the underlying causes are addressed, for example, the food deserts, the availability of healthful, nutritious, affordable foods, all of those principles work together. Very importantly, when you look at something like social support and temperance, those two are key to building resilience in young people and their choices of health behaviors. So all in all, Emily, it's a really key component to be able to bring these very basic and really not expensive, replicable, applicable habits around the world to make a difference in bringing down the non-communicable disease incidence. I believe this, and my background is cardiology. I've also spent time in internal medicine. I have a specialty in family medicine, and I've seen this at the coalface, that changing the habits that are mentioned in celebrations, introducing the lifestyle practices that are mentioned and supported in celebrations, without question, reduce heart disease, stroke, cancer, diabetes, and chronic lung diseases.
Dr. Orellana, now that we have this background, this beautiful coconut shell summary of what the celebrations program is, can you tell us about ADRA's planned celebrations program in Mongolia? What are its main objectives and why was Mongolia chosen as a focus area for this initiative?
ADRA, in its efforts to improve the health situation of people worldwide, has been following epidemiological profiles and trends, and we have been paying attention to the trend of non-communicable diseases worldwide. So ADRA has been trying to increase its programming, its interventions into programs that could improve the life of people, mostly through lifestyle interventions to tackle non-communicable diseases. So in some conversations with the health ministries, we discussed about the celebrations program, and we thought that this is a program that is well based on science. These 12 principles are strongly based on science, as Dr. Landless already explained. So we decided to take this program and bring this program into the operational space of ADRA, to use this program to help people have a better life, a better health. Now, a challenge that we have come across is this. These 12 principles are well backed by science, but when you come to promoting these healthy habits, you also need to provide people with some tools so they can adopt, they can acquire these healthy habits. For example, we all know that we have to exercise for at least 1 hour of medium intensity exercise every day, or at least 5 days a week. But how many of us are able to really accomplish that goal? So that's where we come in. We wanted to create a behavior change approach to help people, to encourage people, I would say, to adopt these healthy habits. And to narrow things down, we looked at different age groups and the existing programs that are available out there for people to go through that behavior change process. And we found out that there are programs that are geared towards adults, especially to people who are already struggling with the consequences of non-communicable diseases. So they have certain motivation there to change their behaviors, their habits, because they are already struggling with consequences of NCDs. And there are approaches for them. We also found out that there are some approaches for children, which are basically targeting at primary prevention. But we found out that there is a gap for teenagers, preteens and teenagers. So we decided to focus on adolescents when it comes to creating a behavior change delivery mechanism, I should call it that way, for the celebrations program principles to be delivered through this behavior change approach, so adolescents can adopt these healthy habits in a way that is attractive to them, that is, and in a way that is sustainable also. Now to your second question, why Mongolia? Well, Mongolia is a country located in Asia, in between China and Russia. And according to data by the World Health Organization and other institutions, they have some of the highest burdens when it comes to NCDs, to non-communicable diseases. For example, when it comes to death by liver cancer. And unfortunately, in some of those figures, they even reach the world highest levels when it comes to some of those rates of NCDs or NCD risk factors. And if you analyze a little bit deeper, the main risk factors for the NCDs that you find in Mongolia, and likewise in most countries, are individual risk factors. So lifestyle and behavior change are the main approach to be taken when you want to prevent NCDs in those places, in those settings. And that is the main reason why we targeted Mongolia, not as the only destination to be, but rather as a place to start.
And can you also give us some examples of how ADRA is operationalizing the celebrations program into the principles, rather, into programmable interventions? What are some of the key activities that have been conducted or that ADRA plans to conduct? And have you noticed any measurable impact of these activities yet?
It is said that there is power in partnerships, and we really believe in that principle. So we teamed up with the Loma Linda University, which is a well-known educational institution for, as Dr. Landless already explained, for their efforts on healthy living and lifestyle approaches and interventions. So we partnered with them to have the proper documentation for this behavior change approach that we are developing for the celebrations program. So what we are doing right now is that we are documenting the implementation of this program in Mongolia. To what extent the program is effective, what are the main challenges, what are the main lessons that are being learned through the process. And to start with that, you have to start with a baseline to measure where things are at right now before you even start the interventions. So that's what was done initially. The baseline survey has been completed, the data has been collected and has been processed, and we came across some very interesting findings. As Dr. Landless mentioned, when it comes to NCDs, you not only talk about physical health, but also mental health related diseases are also in this group. And we found things among teenagers like bullying, for example. There are unfortunately significant rates of bullying happening among adolescents in the study group that we took in Mongolia. And that is one of the topics that we are targeting right now. So after the baseline data collection was completed, and with the information that with the results and the recommendations from this initial study, we took that information. We also conducted a barrier analysis to see what are the main issues, the main reasons why adolescents are not able to practice these healthy habits, and to listen from them, to listen to their voices as to what could be the main ways, the forms to tackle those challenges. So we believe that if we co-design the interventions, if we co-develop those interventions with the adolescents, with the participants of this program, then it will be something that will be more attractive to them, and it will be something that will have greater acceptance as well. We will continue to measure the interventions, and hopefully by next year we will have some initial results on the behavior change itself.
And lastly, Dr. Orellana, if all of the amazing work that you've already described is successful, do you see the Mongolia program serving as a model for other regions? And what factors would be necessary for scaling or replicating this program in other parts of the world?
As I referred at the beginning to the importance of partnerships, I should also say that it is not only an educational institution, Loma Linda University, that is part of this effort. We also have some important local, national counterparts and partners, stakeholders, both government and private institutions as well. We have as our core partner the Mongolian mission of Seventh-day Adventists, who are providing technical expertise and also mobilizing the youth, the Adventist youth. So peer-to-peer education could happen there. So we hope that this Adventist youth, and that is already happening, they are taking the role of health ambassadors. So to, as we say, to walk the talk, to really lead by example, showing to their peers that even adolescents can have a healthier lifestyle. And we have other partners as well in Mongolia. We are partnering with the government of Mongolia, with the Ministry of Health, and specifically with the Mongolian National Center for Mental Health, to make sure that we are complying with all the necessary ethical requirements for the study and for the interventions as well, and for the sustainability of these efforts. So it doesn't end there when our interventions will be completed. Then some of the core activities and interventions will be mainstreamed into the curriculum of the schools that are included in this initiative. We have 4 schools right now in Ulaanbaatar city, the Adventist school, Tusgal school, and 3 public schools. So we hope that this is the beginning of something that will be scaled up within the country, but also in other places, in other countries. We have a working relationship, a collaboration, an official collaboration with the World Health Organization in Mongolia, and scaling it up gradually through the Western Pacific region, which is where Mongolia as a country belongs. Through those partnerships and through those collaborations, we really hope to make it a more sustainable model that can be somehow exported to other places.
It sounds like a really exciting initiative taking place in Mongolia, and I'm really excited to see the final results of the program and the potential replication in other contexts. It just sounds like there's quite a lot of potential. I want to circle us back to you, Dr. Landless, for your thoughts from the church lens of this conversation. Why do you think partnerships between Adventist Health Ministries and organizations like ADRA are important in tackling NCDs on a global scale? How do these collaborations enhance the effectiveness of initiatives like celebrations?
There's a very short, simple answer, Emily, and that is this. Together, we can do so much more. And in my work with the church, as I've done it around the world, to me, it's wonderful to see the footprint that ADRA has. ADRA has a footprint which I'll be driving through the back of beyond in a country far away from where my office is, and I'll see this water pump was erected by ADRA. I'll see food distribution. I'll see development, relief happening around the world. So the importance of having the partnership is to make sure and to ensure that together we can do more in changing lives for the better. Dr. Orellana mentioned the issues of behavior change and early intervention in young people, schoolwork, working in school settings. This is where habits form. This is where young people learn how to live in the future, where resilience is built and bred. And it's so important that in our collaboration, we focus on the communities we serve, that we find ourselves in. A very interesting component I'd like to share with you very briefly is that right now, throughout the continent of Africa, there's a study going on called the African Seventh-day Adventist Health Study. And it's looking at the communities from Cape Town to Cairo and to see what is happening in the health literacy, understanding, and practices of the communities that we have the privilege to serve. And interestingly, they are using the acronym of celebrations. And I'm excited about that, not only because of the program itself, the initiative itself, but because celebrations is such a neat name. Life is to be celebrated. It is a gift. But you know, it's not a gift for the few to enjoy. it's a gift to be shared with all. We need to serve all as we share this wholeness, as we share this health understanding that we are blessed to have. So the importance of partnerships, and the church partners with ADRA, importantly, with the World Health Organization, with the Pan American Health Organization. We have partnerships throughout the world, and it's been an amazing and wonderful journey. And it's just the beginning, because there's so much more to be done. And I cannot emphasize enough the importance we have on our agendas to work together to get this message out to those who need it most and have least access. And so I really am excited also about the collaboration in Mongolia, because having visited there a few times, I see the real needs there, as there are in every city of the world, every rural area. The task is so daunting that we dare not try and do it alone. So we must, and we should, and there's joy and effectiveness when we do partner.
Dr. Orellana and Dr. Landless, thank you so much to the both of you for coming on the podcast today and sharing with us. As we close, I would like to ask one last question to you both. If a global ADRA-wide adoption and application of the celebrations principles, such as what we're doing in Mongolia, were to take place, what lasting change or impact do you think we could see on a global scale? Dr. Orellana, start with you first.
I would like to mention two things. It is definitely a goal to see empowered communities, empowered individuals, and especially empowered adolescents in our case, with the study, with the intervention that we are working on in Mongolia right now. People who are empowered to take their health into their hands by practicing a healthy lifestyle, by changing those individual risk factors and having healthy behaviors, so they can delay or totally eliminate the appearance of non-communicable diseases. And the second point that I would like to mention is more at the higher level, at the policy level, I would say in general. And I'm speaking more of at the general level when it comes to governing bodies, when it comes to these multilateral organizations and those high-level meetings that take place that were mentioned earlier today in this podcast. There is more attention to NCDs, and I am very happy to see that happening. Now, I still believe that there needs to be more attention paid to lifestyle interventions and the importance of addressing lifestyle behavioral issues in order to tackle non-communicable diseases. I'm not undermining the importance of other interventions like treatments, strengthening hospitals and laboratories and other services that are really important and necessary. But lifestyle should also be highlighted. And it is gradually increasing, taking more and more importance, but I would like to see more of that happening.
Dr. Landless, do you have anything to add?
I concur fully with what Dr. Orellana has said, and he's articulated it extremely well. What I would love to see, and what I believe we will see with this kind of collaboration, using evidence-based, peer-reviewed, replicable health science in sharing all this knowledge, is where knowledge then becomes implemented in development. Part of ADRA's name, development, in ensuring there's also water, liquids, clean water to use within and without, to wash, to be sure of good and adequate sustaining of a healthy life, food security for the same purposes, food production, and then a balance in nutrition. And also to see the development of that resilience, because we are holistic beings. We're not just a body, we're a mind. we have emotions, we have a spirit. So all of that needs to be included. And then when I see what the world is expecting, when they look and as they read about, for example, the Adventist health studies, when they see the differences in longevity, when they look at the blue zones, which include Loma Linda, other parts of the world which have centenarians because of healthful living and healthful eating. Magazines like the National Geographic, US News and World Report, Time Magazine, Economist, they are all citing the increased longevity, the better quality of life experienced by Seventh-day Adventists who follow a healthful way of living. Our duty is to share this with the community, to share it joyously, to share it liberally, with no strings attached, for the betterment of the community and the world in which we live. So much can be done, and I believe is already being done right now. But there's never a limit to the good that can be done.
Well, on that hopeful note, we will leave the conversation there. Thank you so much to the both of you for joining us today.
It's been a real privilege. Thank you.
I'm also grateful for this opportunity. Thank you.
Now, to you, our listeners, if you would like to learn more about tackling NCDs, or if you would like to learn more about other topics regarding health, nutrition, and WASH, please feel free to contact us, the Health Technical Learning Lab, at healthtll@adra.org. To listen to other episodes of the HTLL podcast, please find us and subscribe to us on Apple Podcasts, Spotify, or YouTube. We also now have a Spanish channel for HTLL episodes in Spanish. To check this out, search the HTLL podcast -Español. Thanks for listening, and join us next time for another episode on the HTLL podcast.